office on Manatee in Bradenton, Florida. And I'm a bariatric and weight loss surgeon. I also do general and robotic surgery.
How long have you had this office?
We've been here since 2012.
Okay, now, were you in Bradenton before that?
I actually grew up in Anna Marie Island. I left, I did my undergraduate studies at University of Florida, went to Florida State for medical school, went to Miami for general surgery and fellowship training in bariatrics, and came back.
Tell us again what the procedure entails.
Okay, so as a weight loss surgeon, we do a lot of different procedures to help our patients lose weight. And in the past, many people have been very afraid to come in because no one wants to have big incisions, no one wants to get cut. They don't want to have a long hospital stay. This procedure is it's kind of like a breakthrough. It's been placed worldwide over 200, almost 250,000 times, and it just got FDA approved in America last October. And I was one of the first surgeons in Florida to get training on it. So what happens with this procedure is it's a balloon that gets inflated in the stomach. It takes about 15 minutes to place it, and then we inflate it with about 650 cc's of saline or water. After that, the balloon's expanded and we leave it in, and the balloon stays in for 6 months. So what happens now is, as you kind of see in the model, the balloon ends up taking space in the stomach. So now when people eat, they get full rather quickly. And it also delays the amount of emptying of food, so the food sits there longer and people feel full. So with a combination of monthly follow-ups in our office, where we do monthly visits with our dietitian, we teach diet with exercise, that goes on for a year. People on average lose about 40% of their extra weight. The benefit is there's no cutting, there's no incisions, there's no scarring, and usually we operate on people that have a certain BMI or extra weight. People usually have to be about 100 pounds overweight or have a BMI above 35. With this procedure, it's for people that have a BMI of 30 to 40. So we really have very, very low risk, much lower risk than any of the other procedures that we do. The trade-off is you don't get as much weight loss. You can't really compare this procedure to a bypass where people can lose 150, 200 pounds. But the benefit is very, very low risk. And it's a 15-minute procedure. People go home the same day after surgery.
He is very outgoing. He's very caring towards his patients. Very sympathetic and very knowledgeable. Oh, they all love him. They have nothing but good things to say about him.